Welcome back, guys, to another episode of Hormones Happen. Today, we're going to be talking about the natural production of testosterone and what happens when we take exogenous forms. So, before we get into that, let's talk about what's the difference between endogenous and exogenous. So, endogenous is a term that means we're creating it. That's our natural hormone production, okay? When we say exogenous, we're talking about an outside form, whether that be injections, creams, pills, troches, whatever it may be. It's just something that we're essentially ingesting into our body. We're not making it naturally. And that's important to know moving forward. So let's talk about the normal endogenous pathway for our hormone production. And it's very similar between men and women. There are some specific differences we'll talk about, but it all starts in the same place, in a portion of your brain called the hypothalamus. The hypothalamus releases a specific hormone called gonadotropin releasing hormone. And it sends this hormone to a gland called the anterior pituitary gland, which sits underneath our brain. And the anterior pituitary gland now releases LH and FSH, which stand for luteinizing hormone and follicle stimulating hormone. They're both named for the actions that they have in women, but they do the same thing for both men and women, essentially. So what will happen is, for a man, this LH and FSH will travel down to the testes and stimulate, Leydig and Sertoli cells to make testosterone, androgen-binding protein, inhibin, but most notably testosterone. So it goes hypothalamus, anterior pituitary, testes, testosterone. That's the natural production. We call this the hypothalamic-pituitary-gonadal axis. Now, for women, it's the same thing. Starts in the hypothalamus, gonadotropin-releasing hormone, goes down to the anterior pituitary gland, LH and FSH. This is where a little bit of changes happen because, unlike us guys, women cycle their hormones, right? You have menstrual cycles. And so what that means is that there are periods of the month where we can expect them to be high and periods of the month where we can expect them to be low. What happens during this cycle is the anterior pituitary gland will send FSH, follicle stimulating hormone, down to the ovaries and say, guys, it's time to have a cycle. So what'll happen is several eggs will get encapsulated by what's called a follicle, and they'll start to grow bigger and bigger and bigger until one's bigger than all the other ones, called the dominant follicle. And what's important to know is during this process, estradiol is being released, by that follicle. Now, it gets so big, the brain says, guys, this thing can't get any bigger. We need to ovulate it. So what'll happen is the anterior pituitary gland sends LH down to the ovaries, which increases our testosterone, causes that follicle that has the egg inside to break open, releasing it, and then it folds over on itself and becomes what's called the corpus luteum. Now, that corpus luteum makes progesterone. What happens is the fallopian tube comes and picks up that egg. And remember, our testosterone's sky high because we want our libido high, because one of two things is going to happen. The egg's going to get fertilized and you're going to get pregnant, or the egg's not going to get fertilized. And so that corpus luteum will continue to break down, progesterone levels will decrease, and the uterine lining will shed. So those are the two outcomes there. And so that's one caveat to testing hormones in a female who is still having menstrual cycles is, when do we check? When do we assess the hormones? Some practitioners will say day 15 to 20 during the luteal phase. If you're having normal, regular periods, consistent, I don't really think it matters too much. Chances are, if you're going to a hormone clinic, you're probably not having regular, normal periods anymore. And so that's one of the differences. So with either one of them, when we start to use exogenous hormones, our brain's smart, but it's not that smart. It doesn't know we are now injecting testosterone cypionate, or we are now applying a hormone-based cream, to our knees or inner thighs. It thinks it's making too much. And so it says, shoot, why am I making so much of this hormone? And so what it does is it stops the natural production, which means no more LH, no more FSH. And there are some specific things we need to think about for both men and women during this process. For men, we have to think about fertility, because when our natural production of testosterone decreases and ceases, our intratesticular testosterone does too. And our intratesticular testosterone is typically quite high, roughly 100 times higher than what's in our blood, because high levels of testosterone are needed for sperm health. And so when this happens, guess what? fertility is now decreased. And this is why people say you can't have children on testosterone. So it does decrease fertility. There's no doubt about it, but it is not birth control. And that is very, very, very important to know. I have several patients who have children after starting TRT that didn't before. Okay. And that's just the way it goes. Everyone's different. But there are things you can do to troubleshoot these fertility complications. I want you to think of your brain as kind of like a thermostat, and you have your baseline testosterone here. What'll happen when you're taking exogenous forms is you'll be up here. But if you stop for whatever reason, it's going to slowly come down and it's going to pass below that baseline. When this happens, the brain senses this and it starts to make LH and FSH again. And so the question is there ever a time where it won't do this? Because theoretically, it comes back to baseline. Boom, you're at baseline for a while, your fertility comes back. Well, the studies have shown that even in people that have been on it for 30 years, it could take up to a year, but it'll happen. And I've got several patients who have wildly abused steroids in the past, who have gone their blood checked. And guess what? Their natural production has come back. And I'm not talking just testosterone. I'm talking a lot of synthetic androgens, really vile shit. Okay. And so I don't know for sure. No one can say for sure, but in my experience, I've seen it always come back. And so once again, does the fertility always come back? That's hard to say too. Some guys will take a break from their testosterone to have a child and then get back on. There are other medications or adjuncts you can use during TRT to help improve fertility, right? We have HCG, gonadorelin, and clomiphene, Clomid. I'd say the most common is probably HCG, human chorionic gonadotropin. As a man, we make small amounts. It's predominantly produced in the placenta of a female. And what it does for us is it is what we call an LH medic. So our body treats it like luteinizing hormone. And what that means is that it will send signals down to the testes to produce testosterone, which then increases our intratesticular testosterone again. Now, the caveat to this is that you have to have working gonads, testes. The testes have to be responsive. So if you've got a severe primary hypogonadism where the testes are compromised for whatever reason, this isn't going to work. So that's one caveat that you need to think about. Now, for women, right, we're now using exogenous hormones. LH and FSH are suppressed. What's going to happen now? Well, we are going to with continuous hormone replacement therapy. That's important to know because there's really two different categories of hormone replacement therapy. There's continuous and then there's cyclic. With cyclic, you're taking the estradiol daily and usually testosterone daily, but you're cycling the progesterone, okay? You are taking it the last 14, 15 days of the month, and then you stop for about 14, 15 days. What happens is this will prompt a bleed, okay? And so some women want to do that. I don't currently have any patients. I've talked to several who have done it in the past. I haven't had anyone say it's been a great experience, okay? The other one, most common, is continuous hormone replacement therapy, meaning estradiol, progesterone, and usually testosterone every single day. And what's going to happen is we're going to suppress periods, okay? You shouldn't have any more periods after about 3 months. After about 3 months, we should have you dialed down. We should have your hormones at a steady level. You're at good concentrations for you, and you shouldn't have any more periods. And if you do, they're very infrequent, very light, okay? Now, what's important to know is that during that first 3 months, you can get some breakthrough bleeding. And so for someone who is postmenopausal, this is a very important teaching point that for that first 3 months, expect whatever the lining is right now, you're going to shed it. Your body's going to remember these hormones and it's going to say, oh my God, are we 20 years old again? And it's going to shed that lining. After 3 months, you should have no more bleeding or very light, very infrequent spotting. Now, one issue of bleeding postmenopausal is that we could be masking a serious complication, right? We don't want to bleed. If you're not bleeding anymore, you're not menstruating, we don't want to start bleeding regularly, okay? I feel like it could be masking a more serious cause. So if you are bleeding after 3 months, some kind of dose adjustment's needed. Typically, in my experience, we just bring that estradiol down a little bit, and that seems to work just fine. There are a lot of things you can do, a lot of troubleshooting you can do. It just depends on the person, the experience of the provider, and then, of course, the therapies that you're using. So now that we've talked about the natural production of hormones and what happens when you're taking it exogenously, what about the mental aspect of it, right? Because a lot of people will say it's cheating, it's the easy way out. Oftentimes women we'll talk to their primaries or whatever, and they'll say, welcome to the club. This is natural part of aging. But the reality is, guys, who cares? Who cares what other people think? Because at the end of the day, you're the one that has to live with your symptoms, right? You're the one that is living your life. And if you can optimize it, who cares what anyone else thinks? Is testosterone cheating? Sure. How can it not be? It improves your mind. It sharpens your mind. It gets rid of brain fog. Your gym sessions are better. Your libido's higher. How is it not cheating? But I ask you, how can you cheat at life? So that's my main question. And the only reason I bring this up is because I get a lot of people who they know they want this. They know this would benefit them, but they're so afraid of what other people may think. They may even be on it, but they hide it from their family or their friends because they're ashamed. And a lot of that is due in part to the culture that we've created around these hormones and the fact that we've created these negative stigmas of taking the easy way out, of not wanting to suffer. And, it's double-edged. We're not just having the natural decline of age that we used to. We are in a different environment now. We have so many preservatives in the food, BPAs in the plastics, fluorides in the water. Our hormones are not aging at a normal rate of regression. We are seeing acceleration in decline in testosterone. And we are now at a really odd point where we'll see young men come into the clinic with levels that are almost in the double digits. So is it fair that that young man is never going to experience a peak in his testosterone, never experience a prime? He's just going to be moseying through life? I don't think so. Testosterone replacement therapy isn't just for your 50, 60-year-old guy who's lived a great life and wants to just reamp it like he was his 20s again. There are some people that are never going to experience the amazing feeling of having those optimized levels of testosterone at any point in their life. So when you really think about it, who cares what other people think? Because other people are always going to hate on someone that's doing something that they are hesitant to do. And then they see someone succeeding at it.